Today I want to address one of the most common complaints in my constituency office around long wait times in the emergency department. Now, for the longest time in the ER, when I get a patient complaining about wait times, I'd explain how hard everyone is working, the systemic barriers that are making wait times so long, and then I tell them to share their concerns with the MPP. Now that I am the MPP, I wanted to talk to you a little bit about what needs to change in our Ontario government. I'm Adil Shamji. I'm an emergency and family physician. I'm also the MPP for Don Valley East and one of the Ontario Liberal Party's health critics. And this is why ER wait times are the way that they are. If it feels to you like ER wait times have gotten pretty bad lately, it's because they are. This is a graph right here. We don't need to get into any of the details, but this is Ontario health data that I got a hold of a couple months ago. And all you need to notice is that the lines at the top, orange, blue, red, purple, those are the ER wait times and how long people have been staying in emergency departments for the last 4 years. The ones at the top, the ones for the last 4 years, are the ones under the current Ford government. And they're way higher than everything else going all the way back to 2008. So it's true, they are worse than they've ever been before. And it's not just about how long people are waiting in the emergency department. It's how long they're waiting after they've been admitted to hospital to actually get into their bed upstairs somewhere else. In fact, we're seeing that people are waiting up to 38, 40, sometimes even 48 hours before they move out of the emergency department. So why is it like that? Well, healthcare is a tough thing, and to some degree, there will always be an element of waiting in the ER, and that's because of triage. The most sick people get moved to the head of the line first, and people who aren't as sick have to wait a little bit longer. But there's a lot more to it than that. When you break it down, there are really 3 reasons that wait times in the ER are as long as they are and as bad as they are. Number 1, we don't have enough hospital beds in our province. Number 2, we don't have enough healthcare workers, especially doctors and family doctors in particular. And number 3, we don't have enough public health and messaging around how people can stay healthy and avoid getting sick in the first place. So let's tackle these one by one. First of all, Ontario has one of the lowest number of hospital beds per person compared to any other province in the entire country. What you see over here is some data from the Financial Accountability Office that came out, honestly, just a couple of weeks ago. And it shows that almost every other province across the country is faring significantly better than we are. That, combined with unprecedented shortages in bed space in our long-term care homes and in people being able to access home care, has created this phenomenon of hallway medicine, where on any given day in Ontario, up to 2,000 people are getting care in unconventional spaces in our hospitals. We're talking bathrooms, closets, hallways, and when there isn't space upstairs in the hospital, they're waiting and taking up rooms in the emergency department, preventing people from getting seen in the first place. That's a phenomenon that in emergency medicine we call boarding. And this is an article from the Canadian Journal of Emergency Medicine that just speaks to how problematic the phenomenon is of boarding and how it impacts increased wait times in our emergency department. Now, the second problem that's making your wait in the emergency department so long is because so many people don't have access to primary care. Here's a study from the Ontario College of Family Physicians. It says last year, 2.5 million people in our province didn't have access to a family doctor. That's a problem because a lot of things can get taken care of outside of an emergency department. Now, I have to say, I don't blame people if they don't have a family doctor and they don't know where to turn. I don't blame them for choosing to come to the emergency department. It's not their fault. In fact, in some parts of Ontario, where there aren't enough family doctors, the emergency department might actually be the only place to go. But if the emergency department is your only option, no wonder we have as many patients as we do sitting and waiting for hours and hours before they can actually get seen by an emergency physician. In fact, last year I released some data from the Ministry of Health that showed thousands of family doctors are on the verge of retiring, and in particular, about half of the municipalities in the province of Ontario don't have a single doctor taking on patients. So what are you supposed to do if you're in one of those communities and don't have a family doctor? You end up in the emergency department, which is a place where you can get care, but it's not the fastest place to get care if you're not critically ill. What would you do if your child was feeling really sick and you couldn't find a doctor to treat them? It's not the fault of parents or patients for turning to the emergency department, but it is a reason when maybe 10 or 20% of our ER patients are actually non-acute issues. It's not a surprise that ER wait times get as long as they are. And the final and third reason that I want to touch on today for why ER wait times can get as long as they are is that our province is not focused on delivering the right care in the right place at the right time. I already mentioned we've got tons of shortages in home care and long-term care, not enough people with the family doctor. But besides that, we're not even doing the work to prevent people from getting sick in the first place. Let me give you an example. Every single year, and every fall in particular, we see a massive increase in ER wait times and emergency department attendance as hospitals get slammed by people who are sick from respiratory infections like influenza, COVID, and RSV, respiratory syncytial virus. The government has taken no action to make sure that people are educated about this, are vaccinated, or are getting care in the right place. Lots of people have probably seen Doug Ford's ads about the Ring of Fire or about Ontario Place, but when's the last time that we got a message about getting a flu shot? And this is why it's so important. Here's the most recent data from Public Health Ontario. It shows that influenza levels are at very high levels, resulting in very high numbers of hospital admissions. The writing's been on the wall about this for weeks. But the government, Doug Ford, have done nothing. They've done nothing to make sure that people get vaccinated or getting care in the right place or how to find care. Instead of advertising those things or telling people about 811 where they can talk to a nurse 24 hours a day, 7 days a week, the government has instead been spending $110 million on self-promotional advertising, according to the Auditor General last week. So there you have it. If you feel as though things are worse than ever before, they are. And it's because of major issues with hospital capacity, shortages of healthcare workers, a lack of primary care access, and not enough public education about people getting the right kind of care at the right time and in the right place. The right kind of care, like vaccinations. So there you have it. I'm Adil Shamji, and that's why you're waiting so long in the ER.